You've definitely seen them, right? In the pharmacy aisle, maybe at your physical therapist's office, that little box with all the wires, promising drug-free relief for that pain that just won't quit. It's a TENS unit. But does this little gadget actually live up to the hype? Let's dig into the evidence and find out.
Yeah, they're marketed for just about everything, from a sore back to arthritis. And the promise is so simple. Just zap your pain away. But, the real story is usually a little more complicated than that, isn't it?
So that's what we're going to tackle today. We're going to figure out what this thing even is, how it's supposed to work, what the science actually says about it, and most importantly, we're going to give you a practical guide on how to use it safely and get the most out of it at home. Okay, first things first. Before we can use it, we have to solve the mystery of what's actually going on inside this tingly little box. That big clunky name, Transcutaneous Electrical Nerve Stimulation, actually tells you everything you need to know. Transcutaneous just means through the skin. That's it. So all this little device does is send safe, low-voltage electrical signals through your skin directly to the nerves in the area that hurts. See? It's not magic, it's just really targeted nerve stimulation.
All right, now this is where it gets really cool. How on earth can a little tingle possibly block out some serious pain? Well, the most popular explanation is a concept that pretty much changed the game for pain science way back in the 60s. It's called the gate control theory.
And don't worry, you don't need a medical degree to get this. All you really need to do is think about a traffic jam.
So, picture your nervous system like a city's road network. You've got these tiny little side roads, those are your small nerve fibers, and they're the ones that carry pain signals. But you also have these huge, multi-lane superhighways. Those are your large nerve fibers. They carry all the other stuff, like touch, pressure, and that tingling feeling from the TENS unit.
And here's the brilliant part. The TENS unit sends its buzzing, tingling signals speeding down those big highway nerves. This creates so much sensory traffic, so much noise, that it causes a massive pileup at a sort of checkpoint or gate in your spinal cord. And because of that traffic jam, the little pain signals trying to merge in from the side roads, they're totally blocked. The gate is effectively slammed shut, and the pain message just can't get to the brain.
And look, here's the fancy science speak for our traffic jam. When you see large, myelinated nerve fibers, just think highways. And small, unmyelinated C fibers, yep, those are our little side roads, carrying the pain. So when it says the signal is inhibited from reaching the cortex, that's just the textbook way of saying the traffic jam is working. The pain signal is blocked before your brain even knows it's there. Same idea, just different words.
Okay, theory is cool and all, but let's get down to business. How you actually use one of these things correctly. Getting this right is so important, not just for it to work, but for it to be safe. So let's walk through the setup step by step.
Now the order here really matters for safety. Step 1, and I can't say this enough, make sure the unit is completely off, okay? Then put the sticky pads on clean, dry skin, usually bracketing the area that hurts about an inch or so apart. Once they're stuck on good, plug the wires into the pads and then into the unit itself. And only after all of that is done do you turn the unit on. Start the intensity at 0 and just slowly dial it up until you feel a strong but comfortable tingling sensation.
All right, so most of these units have two main modes you can choose from. High frequency is that constant buzzing or tingling we've been talking about. This is for immediate relief. It's all about closing that pain gate right now. Then there's low frequency. This one feels different. It's more of a pulsing sensation, strong enough to actually make your muscles twitch a little. The goal here is totally different. It's trying to get your body to release its own natural painkillers, like endorphins, to give you longer-lasting relief even after the machine is off. For that most common high-frequency mode, this quote is the golden rule. That word, paresthesia, it's just the medical term for that tingling, buzzing feeling. So your goal is to get a strong, comfortable tingle, but not so strong that your muscles start contracting or twitching. That's the sweet spot. That's where you're closing the pain gate. So we have the theory and we have the how-to guide. But now it's time for the million-dollar question. Does this thing actually work? It's time for a little reality check from the world of science. I mean, let's take chronic low back pain. It's one of the biggest reasons people go out and buy a TENS unit. So what happens when researchers actually put it to the test in properly controlled studies?
So what you're seeing here is a summary from what we call systematic reviews. That's kind of the gold standard of medical evidence, where they pooled together lots of individual studies. And for chronic low back pain, well, the conclusion is pretty clear. It's underwhelming. We see phrases like insufficient evidence and not beneficial. Now this is super important. It doesn't mean it can't work for certain people, but it means that when we look at the big picture, the strong scientific proof just isn't there to recommend it as a routine treatment for everybody.
So what's the bottom line from all the research? Well, it's complicated. For some individuals, TENS does seem to provide some real, though often temporary, relief. But it's not a magic bullet. Your body can actually get used to it over time, which makes it less effective. And we absolutely cannot ignore the placebo effect, which is huge in pain research. The simple act of doing something to treat your pain can make you feel better, which makes this device incredibly difficult to study properly.
Okay, everybody, please pay close attention. This next part is without a doubt the most important section of this entire explainer. While TENS is generally safe, there are some absolute red flags, situations where you should not use one, no exceptions.
Please take this very seriously. If you have a cardiac pacemaker or an implanted defibrillator, do not use a TENS unit. The electrical current can interfere with it. If you're pregnant, never apply the pads over your abdomen. If you have epilepsy, it's not recommended. And this is a big one, never place the electrodes on the front or sides of your neck or anywhere on your head. And finally, never use it on open wounds or on skin that's numb because you wouldn't be able to feel if the intensity is too high and causing a burn.
So, after all of that, the theory, the how-to, the mixed evidence, and the major safety warnings, what's the final verdict? What's the one key takeaway you should leave with today?
This is it. This is the most important thing to remember. A TENS unit is a tool to help manage a symptom, pain. It is not a cure. It's not going to fix the arthritis in your knee or heal a herniated disc. It's just one tool in a much bigger pain management toolbox that should always include things like physical therapy and exercise. It's an addition, not a replacement.
And that's really our whole goal here. It's not to tell you to use a TENS unit or to avoid it. It's to arm you with good information so you can be a partner in your own healthcare. Now, you can have a much smarter, more informed conversation with your doctor or physical therapist about whether this low-risk tool might have a place in your personal pain management plan. And that's a great place to start.